I was the endocrinologist on the executive committee, and we had the notion of assessing whether patients who did not have diabetes, and that was about 55% of the original cohort, so about 2,600 patients did not have diabetes at baseline. So we said, well, this is a great opportunity to see if going on this glucose lowering medication could prevent those individuals from developing diabetes during the trial. Why is that important? Well, we know that patients with heart failure, number one, there are lots of individuals with diabetes and heart failure. And when you look at the non-diabetic individuals with heart failure, lots of them have what was sometimes called pre-diabetes. In other words, glucose levels that are close to the diagnostic threshold for diabetes, but not yet. Some use the term dysglycemia. Suffice to say that it's a high-risk state, meaning that those individuals, when tracked for several years going forward, tend to develop more diabetes than if their blood glucose was completely normal or their hemoglobin A1C would be completely normal. Because we anticipated that many of the patients in DAPA-HF who didn't have diabetes would have pre-diabetes, we said this is a good opportunity to test this notion as to whether this SGLT2 inhibitor, dapagliflozin, could potentially prevent them from getting diabetes. So we pre-specified an analysis that those patients randomized to either dapagliflozin or placebo would be tracked over the duration of the trial. And we used the hemoglobin A1C as a very simple metric to assess for diabetes, and this was measured periodically during the trial. Now, to some degree, we're a victim of our own success with DAPA-HF. And the reason I say that is that the study was event-driven, so it's terminated when sufficient numbers of primary outcome events are ascertained. And because the events were more frequent than had initially been anticipated, and a large treatment effect of the dapagliflozin, the study only lasted about 18 months. Now, for those of you who may be used to reading diabetes prevention trials, they typically go on for at least 3 years because it takes some time to develop diabetes. So unfortunately, we were not, well, fortunately for patients, but unfortunately for the purposes of the sub-study, this diabetes prevention sub-study, we were curtailed at 18 months. Having said that, we still had a significant treatment effect. So the numbers of patients that developed diabetes who were randomized to dapagliflozin, the risk reduction for their developing type 2 diabetes was reduced by 32%. So the hazard ratio being 0.68, 32% relative risk reduction. And what we also determined is that it was the patients who had pre-diabetes, not surprisingly, those individuals constituted more than 95% of the overall cohort that developed diabetes. In other words, the non-diabetic patients, 2,600 non-diabetic patients, it was about 2/3 pre-diabetes, 1/3 normal hemoglobin A1C under 5.7%. It was from the pool of the pre-diabetic individuals, that 67% of the cohort with pre-diabetes, that most of the diabetes events occurred. So they contributed 95% of the, not surprising because, you know, this is it's really a biochemical diagnosis, and if you're closer to the finish line, you're more apt to finish or cross that threshold, if you will. So those are the major results of the trial, of the sub-study that I presented this morning.